Good day everyone, I am Matrina Alin A. Cordero from BSN 12 Section F, and today I will be performing my return demonstration about pediatric resuscitation. So this involves a child or an infant who needs an immediate resuscitation. And to begin with, we need to check the environment and make sure that it is safe. Next is we need to check the patient's level of consciousness, and if the patient is not responding, we'll have to activate the emergency response system. Baby, can you hear me? Baby. Mom, please call 911. We have an emergency here.
Hi, this is 911 emergency. How can I help you today?
After doing that, we need to check the patient's ABC, the airway, breathing, and circulation. We'll also need to open the patient's airway, and if the patient is wearing constructive clothing, we need to loosen it up. Also, we can also do the head tilt and chin lift to still open the airway. Now we'll need to check for the patient's breathing using the look, listen, and feel method. And this is to look for the chest rise and fall, then listen for breath sounds, and then feel for respirations of air. 4, 5, 6, 7, 8, 9, 10. As you can see, the patient is not breathing. Now I'm going to give my patient 2 rescue breaths. I'm going to get my face mask to cover the patient's mouth and nose, and I will deliver 2 rescue breaths. 1, 2. After doing that, check again the patient's breathing and pulse. 6, 7, 8, 9, 10. Now, as you can see, the patient is not breathing and has no pulse. Now, I am going to proceed in giving the patient cardiopulmonary resuscitation. And my patient here is an infant, and infants are within the range of 1 month to 1 year old. In order to do that, in order to deliver chest compression, we'll need to use 2 or 3 of our fingers, or we could also do the 2-thumb technique, wherein we encircle the baby's body using our hand, and then let our thumbs rest on the chest area of the patient and start the compression. Now I need to locate the lower half of the breastbone just below the nipple, and then start giving chest compression at the rate of 100 to 120 compressions per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After that, we need to give our patient 2 rescue breaths. Now, we'll need to continue chest compression and rescue breaths until the next responder arrives to take over the patient. In here, we need to ensure that in doing chest compression, there is a complete chest recall, and then the depth of the compression is only 1 to 1.5 inches between, because we don't want to fracture the baby's bone. And also, for every rescue breath, there should be a visible chest rise. Now, if the patient is a child, the age range is about 1 year old to 8 year old. We'll have to perform the chest compression using the heel of our hand and put it at the lower half of the breastbone, because we don't need to fracture the bone of our patient. Next is give the patient 30 compression and 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30. Still, the depth of the compression should be at 1 to 1.5 inches, and give the patient 2 rescue breaths. 1. Now, after doing that, continue doing the cardiopulmonary resuscitation for 5 cycles and 2 rescue breaths. And after 1 minute of the CPR, pauses and check for the patient's signs of circulation. Now, the patient's circulation has already returned, and we need to put the patient in a recovery position. And in order to do this, we'll have to place the arm that is nearest to you in a right angle, then grab the hand that is farther side the place of the back and the other hand on the patient's cheek and hold it there and grab the farther knee, flex it and grasp the leg to roll the patients to the side. Now, we need to wait for the rescue responders, and then after everything, we need to document the time and procedure started and the time of recovery in order to prove that the situation has already happened. And that will be all with my return demonstration for pediatric resuscitation.